What if I told you that aging isn't just about genetics or time? It's about cellular health, hormonal balance, and having access to the right science-backed interventions. Today, I want to show you how true anti-aging works from inside out. Most anti-aging approaches focus only on what you see in the mirror: wrinkles, age spots, sagging skin. But real anti-aging happens at the cellular level. It's about optimizing your mitochondria, balancing hormones, reducing inflammation, and supporting your body's natural regeneration process. At EverYouth, our anti-aging protocols go far beyond the surface treatments. We address aging at the cellular level, combining aesthetic procedures with nutritional optimization, hormone balances, cellular regeneration therapies to help you not just look younger, but feel younger too. Hi, I'm Dr. Maria Starchook-Moore, physician, mother of 3, founder of EverYouth Clinic, and your partner in personalized wellness. I understand what it's like to juggle multiple roles while refusing to lose yourself in the process. My own anti-aging journey began when I realized that feeling exhausted and watching my skin change wasn't just normal aging. As a physician and a mother of 3, I needed solutions that would help me maintain my energy, my confidence, and vitality, and help me manage my demanding lifestyle. Through comprehensive testing and personalized protocols, hormone optimization, cellular regeneration therapies, and targeted aesthetic treatments, I discovered how to slow aging from within. The result wasn't just looking better, it was feeling like myself again. This is exactly what helped one of my patients who came to me who was feeling like she was disappearing. Through our integrated anti-aging strategy, combining hormone balancing, EBO2 therapy for cellular renewal, and aesthetic treatments, she didn't just regain her appearance, she reclaimed her confidence and vitality. Our anti-aging protocols address every aspect of the aging process through a multi-layered approach that's personalized to your unique needs. We start at the cellular level with therapies like EBO2 ozone treatment that detoxifies your body and supercharges your mitochondria, and stem cell treatments that harness your body's natural healing power, and hormone optimization. Hormone optimization is crucial for anti-aging. We address declining hormone levels that affect energy, skin quality, muscle mass, overall metabolism, and vitality. Our aesthetic treatments enhance your natural beauty with precision, from advanced injectables to skin rejuvenation with physical modalities, hormone support, and peptide support. You will feel enhanced and maintain your natural youthful appearance. Sarah came to us struggling with gut issues, hormone imbalances, and feeling like she was aging rapidly. So we used a comprehensive anti-aging approach and helped her optimize her health. We used a peptide protocol to restore her gut after years of hormonal contraception and gut disbalance. We used other peptides to address her metabolic issues. We used a supplement protocol and a lifestyle modification protocol. At a young age, Sarah was having a lot of unexplained symptoms that were vague enough for her doctors to tell her that all of her testing and symptoms are normal, but are distressing enough where she was really struggling and unhappy with what's going on. We used a tailored staged approach and started slowly unraveling her symptoms. We used peptide stacks, one in sequence after another, saw which ones worked, and then subsequently adjusted and used other ones. We used a little bit of detox protocols. We were able to regulate her hormones. We got her off of years of using oral contraceptives for reasons that she really shouldn't have been on them. That helped her restore her gut. We used another peptide protocol to accelerate the gut restoration, used some supplements to balance her cycles, and at the end result, she felt better energy, she felt like her gut was working again, she lost 20 pounds, and she was feeling just happier and better overall. Because true anti-aging is a journey. It's stacked, it's sequenced, it has a feedback loop. It's not a destination. I've created exclusive membership packages that provide comprehensive ongoing treatment and care. Our anti-aging memberships include regular aesthetic maintenance, hormone maintenance, optimization, periodic testing, priority scheduling, and access to the latest innovations. Members receive personalized care that evolves with you and ensures that your results aren't just achieved but continuously optimized and maintained. So you can have your treatments in 2 ways. You could have a la carte treatments, meaning we have a consultation, we identify each individual thing that you need, and you get them done as able. Sometimes cost comes into play and patients either can't afford or don't want to get individual treatments that I recommend. So the main benefit of a package is that you pay for all your testing and treatments up front, and you kind of don't have to think about it. And I've identified some patterns of things that typically happen to a specific demographic, and I've identified the most commonly used and sometimes more tailored diagnostics and treatments, and we include them all in a package. So the benefit is that you don't have to think about it. You get all your testing and treatments and follow-up, and it's all included in your care. Based on the patients that I see, I have a couple packages. My best friends are in menopause or perimenopause. I have a package for them that includes hormones, peptides, supplements, different kinds of testing. My husband is at high risk for a cardiovascular event package, so things that I do for my husband or his friends, identifying his risk factors for a cardiac event. That includes some advanced genetic testing for heart disease. I've changed some people's treatments based on what their genetics came back, and basically explain what they were doing with their primary care doctor wasn't working. And now that includes a myriad of peptides, supplements, testing, and follow-up. I have a Bring Me Your Daughter package because now, unfortunately, I see a lot of young girls that are basically being treated with either contraceptives where they shouldn't be, or their PCOS or their endometriosis is treated with a very superficial approach, again, treating symptoms, not the root cause. We're trying to conceive, or we want to improve our IVF outcomes package, again, comes from having treated some of our friends that are in their fertility journey, again, to optimize their health and try to improve their outcomes. So these packages, again, are very personal. They're developed based on what I see most commonly on patients that come to me, and they're designed to take the legwork out of it. You don't have to think about what testing you don't need, what supplements you do and don't need, what other prescription medications or compounded medications you need. This isn't just about looking younger, it's about feeling younger, regaining your confidence and quality of life. Our members don't just look good, they slow their aging and they redefine what's possible. This also redefines aging gracefully. I hear this a lot. Oh, you just want to age gracefully, you don't want to do extreme measures, you don't want to look unnatural, just let time and nature do its thing. While that is true, I believe that aging gracefully means making the best of your time here. You don't have to look like a Shar-Pei. You don't have to feel exhausted. You don't have to have limited mobility. You don't have to feel miserable and inflamed throughout your journey. You can look good, feel good, enjoy your time with your spouse, enjoy your time with your grandchildren, and this is available to anyone. It used to be that this is only available to the elites, the movie stars, the athletes, and they have been enjoying that for years, mainly because this comes with a price tag and this is out of pocket. It's not something that insurers cover or even know about. But there is a great momentum now when more and more people are seeing these results, are realizing it's possible, and I think you need to take advantage of that. Avery's story shows how anti-aging goes beyond appearance. So Avery is a friend of a friend, very nice young lady that has been suffering from severe acid reflux and GI symptoms for years. She had been getting EGDs, colonoscopies, seen by GI, and having persistent vomiting and GI disturbances, and just told everything is normal and taken antacid. When I met her and heard about her story, I recommended an oral peptide protocol to help improve her symptoms. That was 2 years ago, I want to say. And after having completed 2 months of her treatment, she's still doing well and her symptoms are still at bay. After years of suffering from severe acid reflux, indigestions, and countless EGDs and testing, I was the first doctor to uncover the root cause of her issues. She periodically takes the same oral peptide once in a while if she feels like she might be getting worse, but overall she feels symptom-free. I hear a lot of people talk about what is functional medicine? What does that even mean? And the definition of functional medicine is a lot of what we talked about today. It doesn't just treat symptoms, it gets deep down into the root causes of symptoms and underlying problems and addresses those. Some of the things that I often hear and some of the diagnoses that I give to my patients do not have an ICD-10 classification. They're not recognized as official diagnoses. They are never going to get reimbursed by insurers, and a lot of allopathic doctors consider them to be non-existent. Yet they seem to be one of the common things that I treat. I treat with standard industry-specific protocols that are widely used, and treating these diagnoses with these specific root cause-oriented treatments is what resolves patients' symptoms. For example, leaky gut is something that Avery had treated, is something that I had treated, is something that a couple of other patients had treated, and it seems to be a recurrent theme. Patients have non-specific GI problems. They go to their doctor, they go to their gastroenterologist, they have a full workup that includes biopsies, blood tests, EGD, colonoscopy. They don't find anything and say you have irritable bowel syndrome, you have GERD, you have some non-specific things, take an antacid, take an anti-inflammatory, we don't really know what's going on with you, and your symptoms are probably in your head. Yet, once you treat leaky gut with the specific peptides, you can use BPC 157 capsules that are nutraceuticals, you can use lorazepam, some fix their gut dysbiosis, and this truly addresses and resolves their symptoms. You also do dietary modifications. You cut out some things, you include some of the correct nutrients, lifestyle medicine style, but this truly helps these people. And this is that dichotomy when you treat a diagnosis that's not really diagnosis and help people resolve their symptoms where allopathic doctors failed. Here's another anti-aging quack diagnosis that again is not registered through the ICD-10 classification, not recognized by insurers, not recognized by a lot of allopathic medicine, yet it has a body of literature, it has an industry standard, and has been successfully treated by practitioners around the country, and that is CIRS. So it's chronic inflammatory response syndrome. It basically comes from a dysfunction that is people that 20% of the population are genetically predisposed to, where their innate immune system does not process an antigen. They basically encounter an antigen, biologic or otherwise, they can't spit it out on the other end, and that sends the patients into a whirlwind of non-specific chronic fatigue type symptoms. Addressing these, putting them through a protocol of detoxification, turning off their neuroinflammation, and then the third stage, turning on their transcriptomic genetically active genes that propagate this inflammation, resolves their symptoms. Now, I have never heard a doctor treat transcriptomics in the allopathic medicine. I hope there are fields of medicine where they use that, but this is a very unique and advanced approach that is not recognized by allopathic medicine. If you're ready to stop accepting aging as inevitable and start experiencing what true vitality feels like, I invite you to schedule a comprehensive anti-aging consultation. We'll assess your current health, discuss your goals, and explore which membership package is best to support your anti-aging journey. I believe that aging gracefully means aging powerfully with energy, confidence, and vitality at every stage of life. At EverYouth, we don't just slow aging, we help you thrive through every decade. Welcome to your anti-aging transformation.